Hi, I'm Dr. Radhika Kopikar. I'm a practicing dermatologist and founder of Kopikar Dermatology Skin Hair Laser Clinic in Vikhroli East, Mumbai. Today I'm here in front of you all to talk about a very common concern amongst our patients, a condition known as atopic dermatitis. It's a very chronic, recurrent inflammatory skin disease with periods of flare-ups and then periods of calm. In this, the most characteristic symptoms that patients face is dry, itchy skin with intense dryness. So if you have very dry, itchy skin and repeated episodes of this kind of itching and dryness, then you may be suffering with atopic dermatitis, also known as atopic eczema. There are two leading causes for this pathology. The first cause is genetic predisposition, which alters the skin barrier, and the second is environmental factors like pollutants, allergens, bacteria, and stress. According to statistics, about 3% of children are affected by atopic dermatitis, but not only kids, even adolescents and adults walk into our clinics with this condition. It's a major concern now because its prevalence has doubled or even tripled in the last 20 years. There are three main characteristics of atopic skin. So if you have repeated episodes of intense dryness and intense itching, then you must listen to this. Number one is alteration of the skin barrier. Because of the deficiency of proteins and lipids in the skin barrier, there is an alteration which increases the skin permeability, which means that now the allergens and irritants can pass into the skin and water can pass out of the skin, leading to water loss, and this in turn leads to dehydration, inflammation and dryness. The second characteristic is an unbalanced microbiome. Staph aureus is a bacteria which is naturally present on your skin, but we have seen that in cases of atopic eczema prone skin, the Staph aureus undergoes hyperproliferation, leading to formation of a biofilm. And studies show that increase in the presence of Staph aureus biofilm also in turn increases the atopic eczema flare-up frequency and severity. So when these two reasons are combined, they generate a third symptom, which is irritation, itching and red patches. So what can we do about it? Since the ultimate problem is dryness of skin, we obviously need a good moisturizer. Any moisturizer won't work. You need a great moisturizer which can address all the three characteristics or reasons for atopic dermatitis. That is a moisturizer which can work on the inflammation, on the skin barrier repair, reducing the biofilm of the bacteria and the itching sensation. Atopic dermatitis can be quite debilitating because it can interfere with your daily routine, your concentration on work, your social interactions and even your sleep. So it's important that it is addressed in a good and effective manner. I know that atopic dermatitis can be quite debilitating because it interferes with your daily routine, your social interactions, concentration and can even affect your sleep. So it's important that it is addressed in an efficient manner to give you maximum symptom relief. One such product that I have been using regularly in my practice is Atoderm Intensive Balm. It's a moisturizer and it's very efficient because it not only acts on the symptoms but also acts on the cause of atopic dermatitis. So how is this different from other moisturizers? Basically, this offers a skin barrier therapy patent which includes lepidogenium. This helps in restructuring and reforming the skin barrier due to the presence of biomimetic lipids and essential fatty acids which help stimulate the synthesis of natural lipids. It also contains sucroester which prevents the adhesion of bacteria, which was the other reason for atopic dermatitis. It also contains P, beta-sitosterol and zinc gluconate which rapidly reduces itching and the urge to scratch, increasing the skin tolerance. So in a nutshell, according to evidence published in the International Journal of Research and Dermatology, Atoderm Intensive Balm breaks the atopic cycle within 21 days by reducing 77% of the atopic dermatitis symptoms. So after understanding what is atopic dermatitis, what is a good product to have if you have atopic dermatitis in order to prevent and treat the symptoms of it, I would also like to share with you some general skincare instructions if you are suffering with atopic dermatitis or atopic eczema. So number one, you must reduce your bath time and also the water temperature. So avoid long showers and avoid hot showers. Avoid scrubs for your body in any form. Use mild cleansers while bathing. and also use pure cotton clothes to wear. Moisturize your skin immediately after bath. Choose to wear cotton clothes. Know your triggers and try to avoid them. Keep your nails short and reduce your stress levels. So since now winters are approaching, I would urge you all to stock up on your moisturizers. This particular one is available at the clinic. You can also consult your dermatologist in order to avoid the flare-ups of atopic dermatitis. I hope this was useful to you. Take care.